minutes, half an hour, I would like to give a presentation on what it is now to work in a 1.5 meter economy. And I've chosen this title because the physical distance is actually one of the most effective measures to avoid to be in contact with the corona virus. But on the other hand, yeah, working in a distance, often through home working or teleworking, also cause some burden on our psychological and mental health. And so that's why I would like to present on one hand a bit data on the importance of respecting the physical distance, how this can be done, and what the important measures are and the impact of it on the different sectors and professions. But at the same time, also would like to give a presentation on the impact on these measures we are all experiencing now on the mental health, but also on how we can deal with it. So that's a bit what I will be presenting. Let me first share some data of publication, because, and that's maybe also a question to you, I'm like in continuous search of trying to figure out how the virus spreads through work. And in fact, there are not so many good publications that try to make this assessment. I think there are a few, and I hope more is to come. But if you have more information on that, it would be very helpful, especially because at the moment, and certainly when a country is considering a lockdown, yeah, then it's important to see which sectors can remain active and work safely versus which other sectors need to be closed because of an increased risk of spreading the virus. So these data, I think, are really crucial and should be provided by the occupational health physician and occupational health and medicine community. One of the first studies that have tried to make an assessment on the risk of getting in contact with COVID-19 through work was a study which took into account an analysis and performed by ONET, which is kind of an exercise was done to try to label and categorize different professions according to the physical proximity a worker working in that sector or in that profession has to others, with the idea the closer the contact, the higher the risk. And the same, another parameter they defined was the risk of exposure to an infectious disease. And these two factors, risk factors, are here plotted together in this graph. And as you can expect, yeah, nurses, healthcare workers are on the top right position. So because it's a contact profession, there's a close contact with the patients they treat, and at the same time it's patients that can carry an infection, so there's also a high chance of exposure to COVID-19. You see, so that's healthcare workers are an important group. Another important group that has been under debate, and I think in many of our countries, for example, restaurants and bars are closed because, yeah, there's an assumption made that waiters and waitresses, they might spread the virus. People come together in a bar, they start drinking, get even more close, and that's what the coronavirus likes, to further spread among the people in the restaurant or the bar. And that's one of the reasons why bars and restaurants are now closed in many of the countries. You see here in the assessment that has been made that that physical proximity is considered high, but actually the exposure to infectious diseases is then rather low. And I think before we start the presentation, I had a bit our informal talk. We talked already about farmers. Farmers, yeah, they mainly work on their own. There's the physical distance can be respected, and consequently, there's also low risk of being exposed to diseases. So that was one of the first studies that was performed. However, yeah, now the question is to what extent this corresponds now with the actual risk of COVID-19, and there was no so much information available until recently, and this is a study that has been performed by Norwegian colleagues recently, that has been not officially published. It's under revision, but still this publication you can find on the internet. And they did it's quite interesting exercise. So they combined different databases and calculate the odds ratio per professional category, and they did that for the first wave and also for the second wave. And so what you see here, that during the first wave, yeah, what I just presented in the first slide, that's healthcare workers, yeah, they have the high risk of getting infected by COVID-19, and then you see that it's very much goes fast down during this first wave to not an increased risk. The exception is here still the bus and tram drivers. And yeah, this also corresponds with other data, and this is a study that has been performed by the European Center for Disease Control, in which they looked at the number of reported clusters according to occupational settings. So again, in March, July, so in the first wave, and 13 EU countries and the UK have participated, and there, yeah, you see that in fact the number of COVID-19 clusters were highest in, again, the healthcare setting, long-term care facilities and hospital, also in the food packing and processing. So this is typical in let's say in the supermarket, one of the other essential sectors, while for the other sectors, there were much less clusters reported. What's the situation now in the second wave we are most countries are in at the moment? Then you see a complete different pattern. I take you to the middle now of this graph, where you see that, for example, the physicians and even lower nurses are not having an increased odds ratio. So the odds ratio is not higher than 1. Which professional categories are affected during this the second wave? That's travel steward, which might sound a bit strange since we are not traveling so much, but of course it's people like working at the train and the bus, for example. Bartender and waiters, which was also to be expected. So if you look, and I've plotted a bit, what I've done now for this presentation is I plotted the adjusted odds ratio of the Norwegian study, and I plotted it against the physical proximity of the ONET database. For the first wave, for you, that's on the left side, the left graph, and on the right side for the second wave. And there you very clearly see the different pattern in which in the first wave, yeah, you see the increased odds ratios which corresponded with the physical proximity, while then for the second wave, yeah, you see a different pattern in which yeah, in the green circles, the dots in the green circles, which are then the bartenders and the waiters, have an increased adjusted odds ratio, while for typical contact professions, the odds ratio is even below 1. What's the explanation for it is the improved preventive measures and equipment that have been taken. And this is also something we have been able to show here in Belgium. These are numbers, a study that has been performed in hospital workers, and which we originally saw that in the beginning of the first wave, that healthcare workers were mainly contaminated in hospitals, not so much in the ICU unit, but rather in other units where they thought that the risk was lower. While if you go to the second half of the first wave, you hardly see any increased risk anymore, because of the availability and the better protection of the healthcare workers. So the procedures and availability of personal protective equipment was according to standards then. And the main risks, and that's something we saw then, but also now, is now in healthcare sector, actually through suspected COVID-19 households, or in informal contacts. If we look then at the impact of COVID-19 in terms of age standardized mortality rates, one of the best data I have found is from the UK, so the Office for National Statistics of the UK, here presenting the age standardized mortality rates of death involving COVID-19. On the left figure represents the data for women, and on the right for men. And you see here what you can expect, that the elementary occupations and the care, leisure, and other service occupation experience or represent more deaths in men. And similar pattern, more or less, you can see in women. So it also reflects in the number of deaths. This is a slide in Dutch, and excuse me for this, but this is a slide I made today, so it's brand new. And actually, let me explain you what you see. So in the x-axis, you see the weeks, week number 30 to week number 44 of this year. And on the y-axis, you see the number of reports, the number of cases that have been reported to our occupational health service. Because one of the tasks now during the second wave was that Belgian occupational health services were asked to do contact tracing. And so you really see here the pickup, let's say, of and the increase in the number of COVID-19 cases in companies, which is here represented by the number of contact tracings we have performed. So the orange line is then the total number of contact tracings we have done in companies, and you see in week 43, 1,800 of these tracings were performed. So quite an important number, which caused a major shift in our activities of occupational health services. Then if you look in terms of which is now the most most contact tracing was performed in the education, so in schools, for example, and also in offices and healthcare sector. So these are the three main sectors from which we were informed about cases and that we needed to do contact tracing. The contact tracing was mainly done to avoid the further spread of the virus on work. But what I regret a bit, and I'm curious to hear your practices in your country, is that we were not asked to perform source tracing, which would be very interesting in terms of risk analysis. So source tracing is not being performed. We are performing contact tracing. So in terms of risk analysis, we need to be careful. But still here you see, yeah, this gives a bit an indication of, also an indication of the spread of the virus through work. Another interesting part is then, yeah, besides contact tracing, we are also asked then to do some tests. At the moment, as in many of your countries, I can imagine there's a big debate of the testing strategy, which test to apply or not. And in long-term care facilities, so the residencies, we are expected here during wave 1 and wave 2 to do PCR testing. And here again, you see the results over the weeks, and you see in the beginning, you see a high percentage of positive, 12.5, but this is rather has to see with whom we could test at the first weeks of wave 1. I was more focused on the symptomatic healthcare workers, while from week 17 we were expected to screen all long-term care facility workers, and then we saw a quite stable positive ratio of about 1%. At the moment, this is higher, is basically up to 5%, and this is important. Why? Because also we kept on doing this testing procedure and strategy when we were getting out of wave 1, and what we observed was actually that the long-term care facility workers, that the positive ratio remained about 1%. And so one of the hypotheses we have, and these mainly asymptomatic workers maybe have reinitiated a bit a second wave in those residencies. So it's a claim on keeping on testing also outside the peak periods of COVID-19. Yeah, at the moment, as I say, a lot of debate on what to test at the PCR, but yeah, at the moment we are also performing serological testing. We are mainly looking at IgG at the moment, and also the fast antigen test is currently being deployed. I expect that the beginning of December it will be completely deployed. Another interesting graph here is the number of claims for occupational diseases. In Belgium, we were, I think, one of the first countries that compensated COVID-19 patients, and actually the criteria used to recognize COVID-19 were quite open. The only thing that people needed to prove was that they were working mainly in the healthcare sector and a positive PCR, and that's actually sufficient to be able to put your claim. At the moment, of course, there's a big debate on whether we should apply the same criteria given in the second wave, but based on the not increased odds ratios as I showed you earlier. Another task that we will be performing shortly, I hope, is then the vaccines. And here you see the different coronavirus vaccines that are at the moment under consideration. I think it's out of scope to go into detail. But one of the challenges for us as occupational health services on the logistics. How will we be doing that, taking into account that most of the vaccines need to be stored in -20 or even a lower temperature? So that will be quite a logistic challenge. Okay, this brings me a bit now to the second part of my presentation. So physical distance is important. during wave 1 and wave 2. And telework is, of course, one of the options we need to consider and to implement in order to avoid the further spread. From in the first wave, we immediately started with the launch of a survey that we launched through Facebook and through social media. And the idea was that we would follow up 6,000, more than 5,000 workers on a monthly basis. And we managed to get more than 6,000 workers, employees in our studies. And the good thing of the originality of this study is that this is a follow-up study. So the same workers kept on filling in the questionnaire. So we are able to do a follow-up study. So it's kind of longitudinal study we have been able to set up, and which allows us to do quite interesting prospective data analytics on it. If you look at the results that I'm happy to share now, is that, yeah, as you can expect, is that in the first 4 weeks of coronavirus crisis, that people felt tense, but at the same time, the stress caused an increased alertness. So that's yeah, that people feel tense and stressed is normal, and I think we also experienced probably also in your team, that people were at the same time alert, and a lot of things happened and keep on happening a bit thanks to the stress as well. Work is important, not for our health, for our mental health, and of course also for the job satisfaction. And and that's a bit the fear we have now with an economic recession that might come, is that of course that the mental health of the population will be affected. And we can predict that a bit of the data here, in which you see we started from workers having paid employment. And if you see then, if people over the course of the COVID-19 crisis, if they get technically partially unemployed or 100% unemployed, that it obviously has a negative impact on their mental health. Despite work has then or not having a job is negative for your mental health, we also see, despite this, that the so-called essential sectors, that the data on mental health were among the working population were most negative, let's say. So the prevalence of fear and feelings of depression were highest in the so-called essential sectors, health and social care, the food industry, and emergency services. So more than 50% reported fear and feelings of depression. And the opposite you see in terms of job satisfaction, the lowest job satisfaction in these sectors. So an explanation, here it's also interesting to follow up the trends. So I've analyzed here, so we have performed in total 4 waves. Here you see the data of the first 3 waves, and you see that the reported feelings of fear and depressive feelings remained high among all sectors, but then during the 3rd wave, you see that it's decreasing, and that corresponds with losing up the measures and the lockdown regime we were experiencing. And then it's interesting to look a bit at the yellow line here, which represents the data of schools, so teachers. And there you see that the feelings of fear and depression increase, which is not abnormal, because schools were reopening and there was a lot about uncertainty about how to teach in this period, but also whether or not it was safe for teachers to teach and get in contact with children again. So that's, I think, quite interesting. And that brings me then to the important part, saying like, okay, what can you do as an organization? And here I plotted the three most important determinants that have a positive impact on fear and depression. And so you see that employees and organization with a high safety climate, a good family supportive culture, and workplace flexibility, that in these organizations less fear and depression is reported. And let me zoom in the safe climate. You see, it's quite important that if it's high, if it's low, sorry, which was low in healthcare and food and drinks, then that explains a bit why people report more feelings of fear and depression. So health and safety as priority number one, and communicating about it and having your coworkers involved and taking the adequate measures is really important, not only to avoid the further spread of the virus, but also for mental health improvement. If we then look at to what extent companies respect social distancing, you see here that most of the sectors score quite good in an assessment we made. So we carried out workplace assessments, and here I give the percentage per sector. And what you can see is HoReCa, and HoReCa is an abbreviation for hotel, restaurants, and cafes. And there you see that only 60% of the companies we assessed respected social distancing rules. So that's one of the reasons why now in the second wave, this sector is impacted by lockdown. Some words about telework, which is back to new business as usual. And so there's a big debate on telework and mental health. And this is a study that I would like to show you, which we performed actually before the corona crisis. So here in Belgium, one of the issues, and but also internationally, is the ideal number of days you work from home. Is it 2, 3, 4, or 5 days? And in order to address this question, we performed a study in an ICT company. Almost 1,000 workers, employees participated, and so we wanted to see to what extent telecommuting contributed to feelings of burnout or the opposite, work engagement. The idea was the more you work from home, the more negative impact on your mental health. And that was a bit our hypothesis. However, we also took into account some work characteristics and characteristics of the organization, whether or not there was good social support from colleagues, participation in decision making, task autonomy, and work-family conflicts. And so if you take that into account, what we saw, in fact, is that it was not so much the extent of telecommuting that contributed to the mental health outcome, but it was rather how it was organized. So if you experience good social support from colleagues, this decreased the emotional exhausted. So, in fact, so that brought us to the conclusion: it's not the number of days you work from home; it's the way you organize it, set up the right structures, and keep contact with each other. Um, uh, if you want to know more about teleworking and how to do it, I really recommend you to look at this paper of 1997, in which they said, yeah, it actually depends on or characterization of the organization, home family balance, the job characteristic, and also individual personality situation. And I think, yeah, this family situation, it's something that we also observed in our study as being very important, because I've talked already about fear and depression, but here you also see that mainly the single parents with children are experiencing the most fear and feelings of depression. So the family context is plays a huge role in teleworking. And if you look at complaints in day-to-day work life, there you saw that the childless single people scored less for general health, and that had to do, yeah, with the feeling of loneliness, losing the social contact with colleagues and supervisor. And that's also something what you see here in this next slide is where I show that a higher job satisfaction is actually linked with the quality of information, and whether or not there's adequate social support from supervisor and colleagues in times of COVID-19. So which supports then a bit the outcome and the results of a study we performed even before COVID-19. So this brings me a bit to conclusion, referring to a recent study now published in this year, in which they also added the environmental context, the safety measures that need to be taken, and the legal aspects to organize or to take into account when you organize telework and telework policies in your company. So that was my last slide. Thanks a lot for your attention, and I'm looking forward for your questions or your additions to this presentation. And feel free to share the expertise and experience you have in your countries as well. Thanks a lot.
Thank you, Lode. It was excellent presentation, and we learned a lot, and I expect some questions from the audience. Is there any question for Lode?
I want to congratulate Lode. I think your team, you and your team in EDV has done a very good job with all this information from Belgian workers that give us to other countries a kind of answer to many questions that are rising in this very moment. I think in psychiatry they are already giving a name to the third area of impact of this pandemic. I mean, health, of course, not only because the direct effect of the virus in health of people, also because it's retaining all the, or we are focusing all the attention on COVID, and we are not, we are living maybe without no so care to others important diseases. Second, the economy, which is very, very clear. And third, maybe the mental stability and the psychology of people. It is also in danger. Maybe it is another nuclear point or nuclear area of impact, and your results are supporting, I think, this point, and you are giving also, which many others, many data or a lot of information that is going to be very useful for all of us. So I'm very happy to be here. It is a pity other colleagues were not able to join today, but I think they will enjoy your papers. I will find them in ResearchGate immediately. Very, very interesting. I love it. I love them, Lode. If you allow us to put the presentation, to upload the presentation in the website, I think it will be followed for many of us. So it has been my pleasure to listen to you today. Thank you.
Thank you, Begonia.
Thank you, Begonia. I have one question related to occupational diseases. You mentioned that some people got occupational disease complaint regarding the COVID-19. How it is regulated in Belgium? Because there is a lot of debate, is it COVID-19 occupational disease to healthcare workers?
Yeah, at the moment, like I said, during the first wave, COVID-19 was put on the list, which was extremely fast. I've never seen it happening so fast. In 1 month time, basically from knowing that hearing and to having the first patient of COVID-19 in Belgium. Already then having the disease COVID-19 put on the list of occupational disease that has never been done before. But you see that I think the Fund of Occupational Disease put it on the list, so which made it easy to report and put a claim for compensation. But at the moment, there's a big debate on the risk and which professional categories should be considered under risk. I think there was not so much doubt during the first wave that mainly healthcare workers were having a professional risk, and I also supported it with the data I showed you. But during the second wave, it's clear that the healthcare workers are probably not, if they get COVID-19, that it's most probably not through their work, since they are so well protected. And that's, of course, reason of debate. And the unions, for example, they state like, okay, it's not only healthcare, it's also other sectors, workers working in other sectors that have a professional risk and should be compensated as well. But it's very difficult to prove. And that's why I started my presentation of, if you have information that can help us with this exercise, I would be very happy. And I think it's something maybe we can share within EASOM group, because most probably we are all dealing with the same questions. But that's why I start my presentation, to show you a bit what we have and to see whether we could bring things together in order to address this important issue. But for the second wave, as I said, I'm not sure whether Fund of Occupational Disease will accept the same criteria as in the first wave.
Okay. Any other question?
I want to comment something else, because this last things that Lode have commented about the wave and the kind of the profile of the workers that were more at risk and more affected, has created a big debate in my country the last 2 weeks. Even the National College of Surgeons have asked for the resignation of the epidemiologist that have our government in Madrid, because he tried to say something like you have already said, and the head was cut off, because health workers have suffered quite a lot and they don't want to be outside of this, so it is always the same. I think it is good to have good science and to clarify the brain, the mind, and to prove things and see what we can support, what cannot which things we cannot support and understand the reality. So it is the kind of work we need, and I'm very happy to hear all this today again. So I don't know, I saw Elena, Anna, and others, maybe they can say something else on this.
Yes.
I don't know the
Yes,
experience
if it's
in
possible.
your countries.
So hello, please excuse me first of all that I entered a little bit later, but I had to solve something and I arrived a little bit later home. So I saw just the last few slides. Practically, Lode responded at my question about which professions are declared at this moment with this occupational disease, because in Romania we have the same debate. If just people working in the health public sector, in the health sector, is in discussion for a professional disease, or other categories involved in transporting, in caring the COVID persons can be declared like occupational disease. We did not start it yet because it was a long debate. Which are the principles, if they are the general principles applied for an occupational disease, or it's exactly something more specific, more rapid. Finally, we will respect the classical Romanian methodology. But we at this moment try to introduce in the list of occupational diseases this disease. You know, Zoom Medicina Muncii is Florina Popescu. She is here, but not with her name. I want to say that she's here with us too. And our clinic is transformed at this moment in a COVID clinic. I don't work there, but Florina is involved. They started just a week ago. So Lode, it was a very interesting presentation. Really, I want to see it again to analyze better, and maybe after that I can be able to put some questions. But thank you very much.
Perfect, thank you.
Thank you, Lode. Also, I have a question about the occupational disease also. As you said that it's put on the list, is that for all occupations? Because in Luxembourg, they have put it on the list only for healthcare workers, and for the other ones, you can claim for an occupational disease, but you have to prove the relationship between your occupation and the disease. Is it the same in Belgium, or do you have agreed it for all professions?
No, it's the same indeed. The list is restricted for the group of workers with an increased risk, which was healthcare mainly. But yeah, even there, the debate is at the moment that how on earth can you prove that you got COVID-19 at work? Even for a healthcare worker, it's basically impossible, especially during the waves, because then the spread of the virus is more among the population. So it's basically impossible to really try to prove it's. I think it's, and that's why my advice to the Fund of Occupational Disease in Belgium is, if you ask people to prove it, they will never be able to prove it.
Yeah.
So that's not the way you can do it. So you need to make an agreement. You accept things knowing that you will overcompensate, or not accept things knowing that you will undercompensate. But it's an agreement you need to make. At the moment, as long as we are not doing source tracing, which I don't think is, I don't know any of the countries that is doing that, and I don't know. I also wouldn't know how to do it, to be honest.
Yeah.
But that's something we really need to invest more in it, on how to do source tracing. But it's certainly on policy level, one is not busy with that.
And what are the compensations that they have they have only compensation if they have some problems after the acute infection, or what is exactly compensated?
Yeah, that's also a topic of debate, to be honest, because yeah, it's one of the main reasons now that a hospital ask occupational health physicians of the hospital to put claims for their hospital workers with a positive PCR test is actually because then part of the guaranteed wage can be recuperated. So even the hospital thinks they can recover some of the money that's related to the sickness absence. So it goes quite far at the moment.
Okay.
And it's normally it's the treatment and the long-term consequence that will be paid, and also yeah your expenses in treatment and consultation of specialists and things like that, or if you have more if you have a fatality or whatever, it will be compensated as well. But so far, as far as I know, Fund of Occupational Disease has not decided yet on any of the claims on what to compensate. So it's also a subject of debate.
Okay. In Serbia, it is very hard to change the list of occupational diseases. It took us more than 10 years to change the former list to a new one, so it was not so possible in 1 month time, as you mentioned. But our government brought a decree, governmental decree, which gives some rights to the healthcare workers and workers employed in educational sector. So those two groups, they receive full salary during the sick leave caused by the COVID-19. So it is kind of partial solution.
Mm-hmm.
But according to your data, educational sector was not affected at all with the COVID-19. Any more questions for Lode? If not, I would like to thank you, Lode, very much. It was excellent presentation. I believe that we all enjoyed and learned a lot from your presentation, and I believe that we will have a lot of visitors to our website due to your lecture. So let's announce that we will continue with these lectures during this COVID period, and that I believe that you have some announcement regarding the next ESM summer school in Leuven.
Yeah, so depending on whether or not we will be able to travel, I would like to welcome you next summer and for the ESM summer school in Leuven. And normally it will be the last weekend of August, which is a traditional moment to gather for ESM. But of course, yeah, we have to wait a bit to see how we can proceed with it. But I'm in good hope, given the positive news we are receiving from the development of vaccines. But we'll see whether we can travel or not.
Let's hope that we will meet next August in Leuven and that we will enjoy traditional Belgian hospitality.
Yeah, and beer as well. Yeah?
Beer, of course. Okay, thank you all for your participation, and till next lecture on ESM website. I wish you all the best and take care of you and your families. All the best.
Okay, take care.
Thank you.
Bye-bye.
Thank you.
Bye.
Bye-bye.
Ciao.
Stay healthy and in good form.
Bye,
Bye-bye.
everyone.
Bye.